Whenever you log in, we're going to start here on our main dashboard that gives us our schedule and our reminders and our alerts and our messages. But let's kind of take this one task at a time. We're going to start with admitting our first patient to service. A couple of things that we have to remember. One is, like I said, we're doing this the most manual way possible, so we're not really taking into account the integrations that you would have within the software, such as our faxing module. And number two, we're dealing with this from a kind of a generic training perspective. So we're talking about patients in their most generic form. But I think you guys will be able to run with that information and really expand on it within your particular use cases. And I'll try to point out some of those options as we move forward. All right, so let's begin by admitting our first patient. Let's say we check the fax machine and we have a new referral from ABC Hospital down the road. The way that's going to look, again, in its most manual form within the software, is that we are going to go to our patient screen. We're going to click the Add button, and that's going to pull up our Add Patient section. So I don't want to take too long and kind of bore you with details that are pretty obvious. But I do want to run through the Add Patient screen just really quickly. So we'll start by selecting the office that's appropriate for this patient, and then the territory that's associated with this particular office and this patient. When we do that, the system will automatically set these provider contacts for our patient based upon the default contacts that are set up underneath the office territory level. You can always override those if you need to, but this allows you to set up your patient's case manager, intake coordinator, scheduler, marketer very, very quickly by having it default off of your territory list. We put in the patient's name and address information. If you are going to see that patient at a different service address, you have the capability of putting in that address here. So that allows us to bill at one address, but to actually have our point of care mapping go to a different service address. Phone number, cell phone number, additional phone number, the patient's email address, and whether you want to give them access into the patient portal where they can review their invoices, their schedule, their medication profile, etc. You control that by clicking on this button. How the patient prefers to be contacted, gender, date of birth, race, default primary language, social security number, Medicare, Medicaid number. All of that's fairly self-explanatory. I do want to walk through the status options that are available to you. Active, meaning they are an active patient. Obviously, we can discharge them in the future, and when we do, we'll be given a discharge date and a discharge location. If they go into a hospital, or if we put them on hold for any reason, we can set that to on hold. If their services are if we've not admitted them onto service yet, we can put them into a pending referral status. And if we want to put them onto a wait list, we can do that. So on hold is typically going to be for active patients whose services are on hold, either because they haven't paid their bill, or because they're in the hospital, or because they're out of your service area, let's say on vacation, or maybe as a kid they've moved between parent locations over the summer. Then we can place their services on hold. Pending is utilized for patients that we haven't actively admitted yet. usually because we're waiting on an authorization or we're waiting on a meet and greet visit. And then our wait lists are for patients that we haven't admitted yet because we can't find an appropriate provider. So if we have a kid who requires occupational therapy after school, but we don't have an OT available during those hours, then we can put them onto our wait list. And then a declined patient would be a referral that we weren't able to take because they were out of network, maybe out of our service area, or for some other reason. Now, within each of those, we would want typically to assign a status attribute. You guys do control this status attribute list that's available underneath those company setting, the company setting page, the list view. But we give you some of those by default, but just know it's a very powerful reporting tool, so that when you decline a patient or decline a referral, you can track how many were declined because they weren't in network, or because they're not in your service area, or because you were unable to contact them, or if they're pending due to an authorization or a waiting list issue. You can set that here. Start of care date is pretty self-explanatory. Net Promoter Score allows your customer service department to constantly monitor how well or how satisfied your patient is with your service. So I won't bore you with kind of the background details on the Net Promoter Score system. But you are able to track your Net Promoter Score values here at an individual patient level, as well as the reason for their satisfaction or dissatisfaction. By utilizing this particular feature, then you can kind of build some marketing tools, testimonials, etc., to go out to your physicians, or to prioritize which patients you want to contact from a customer service perspective. Then we've hidden some other fields here underneath the advanced section. Just be familiar with them, but most of the time you don't actually have to deal with these because they're set automatically or just not utilized very often. For instance, the county of service that the patient is in, that's going to default to the county of the office, and then it is automatically updated based upon the address or the zip code of your patient. And then if you're a Medicare agency, we automatically set your Q code, place of service. If you've turned on the medical record number, automation will automatically add in your MR number. If your patient changes names, for instance, maybe they get married and their last name changes, or if you deal with pediatrics and you have an adoption or a newborn who receives a new name, you have the capability of tracking their previous name information. Across the top, we have the ability to track the referral information, how the referral was received, who it came from, and at what facility, date and time that it was received, who the marketer for that particular referral was, if it came in all based upon a particular campaign. For instance, if you ran a billboard campaign or an email marketing campaign, you can allocate out and track those statistics. And then you can also track if the patient's currently in the hospital, you can track when they're expected to be discharged from that inpatient facility. If the physician orders a specific start of care date, the admit source and type of admission, both of which should default for you. Contacts, again, pretty self-explanatory, but you can search for the physician. Clicking on the magnifying glass gives you some advanced search options. You want to put in your physician, your case manager would default from the territory, or you could manually select the case manager. Same thing with pharmacy, other provider contacts, other contacts for the patient. So you can keep a list of mom, dad, spouse, you name it, and whether you want to give them access to the physician portal as well. So if you give the patient access to the portal, you can actually control whether these contacts have access to it as well. And then if you've turned on the related employee information, you can track which employees are assigned to this particular patient, what their relationship is, if they needed to sign any additional paperwork. For instance, some insurance companies require conflict disclosure statements when an employee and patient are related. You can track that information. And then you can also utilize this section for those times when a patient refuses service from a particular employee. Maybe they filed a complaint. You can actually exclude that employee from being scheduled to that patient in the future. You can also track additional physicians, for instance, surgeons or pediatricians, if it's not the patient's primary physician. The Services tab allows you to control the case level for that patient, the DNR code, the triage level, and any emergency information. This information will also pre-populate once our point of care admission document is completed. Any other physical characteristics, height, weight, BMI calculation is done for you, whether they are a smoker or not. Default plan of care information such as safety and nutrition information, allergies or functional limits available within the. Again, this will default off of our point of care admission document, or it can be filled out at the time of intake or during any particular service period. Your medication list, we'll cover this in more detail when we go through point of care, but this does give you a full medication listing for your patient, diagnosis and procedure codes, and then any type of billing code, condition codes, occurrence codes, or value codes. Just be aware for you Medicare agencies, we do automatically include the CBSA code onto the MSA or CBSA code and the state and county code onto your claims. So you don't have to hard code those in. But for non-PPS claims or non-PPS patients, you would want to select the appropriate codes for billing if needed. And then you also may want to track any type of OBQI or QA risk associated with this patient. So at the very beginning, we can triage them a little bit better if we have a risk for out-of-control pain or psychiatric conditions. That allows you to run reports based upon those risk factors. Right. Last but not least, you have your patient's financial information. And you tell us at the beginning whether we will be billing the patient as a self-pay account, what the terms of the account are, whether it's taxable or not. And then if you want to set up patient-specific pricing, you can do that. So this would be your fee schedule for all of the services that are available. And if you wanted to set up a client-specific or patient-specific pricing model, you just click on the buttons here in order to set up that service pricing. You can refer back to the service pricing training that we did for more information on that. You also have the capability of billing a legal representative, for instance, maybe a workers' comp policy or an actual like an adult, maybe a parent, instead of just billing the child. And then most of the time within healthcare, you're going to be billing a third-party insurance company. We give you the capability of creating up to 5 insurances or third-party payers for a particular patient. You would just select the payer from the list here, the dates that they are eligible for service, their insurance number, the relationship to the insurance holder. If you need a group name or a group number, you have that capability. and then some other advanced options that we'll talk about when we get into the billing stage. One thing I do want to point out here is that you have a verified benefits option available to you that allows you to track all of your eligibility and benefits information for that patient for that insurance. So whenever you check eligibility and benefits, you can track what their maximum benefit limit is when their year end, the calendar year or insurance year, how many visits or dollars they've already utilized within that within their benefit limit, what their deductible is, what their copay is. And it's also from this screen where if you set up your payer to use our integrated eligibilities, you can just simply click the check eligibility button. And if we were utilizing a valid patient account, you would actually get their eligibility and benefits information returned to you directly on this screen. And the system also tracks those responses, so you have them there for historical purposes. Those eligibilities are handled, like I said, usually through a direct integration within the software that's set up underneath your actual payer settings. So we'll look at that under the billing training as well, but just know that's how it's utilized during the intake procedures. Once you've saved that patient, you've hit the save button, the system will automatically put them into your patient list. You see the little smiley face icon, which is their NPS, Net Promoter Score, so that you, at a glance, you can quickly see which patients are happy with you or not. We give you a little indicator if the patient is still in referral status or if they're on hold. You can search through your patients by name, by assigned employee, by office, by payer, and then just simply click on the patient name in order to get to their cover sheet, basically a summary of the services and clinical information for that patient. You have direct access into their schedule, into their services, along with vital sign charts and tracking, direct access to tracking information. So for instance, if you wanted to track home health aide visits or supervisory visits, you can set all of those tracking items up, and the system will track those for you, which we'll get into on a later training. Financial information for each of the insurances that have been set up for this patient, along with their invoice register and AR, so you can have access directly into their invoices at a glance. You can verify benefits very quickly with the click of a button. You also have access to view their authorizations. And if you have our direct payment connectivity account put into the system, you could actually receive credit card payments or deposits within the software from this screen. You also have access to their medical records, so any files that have been uploaded or documents that have been created in the system are available on the Files tab. You also have a notes section where you can add any type of phone logs or communication notes to the system. And then the More option gives you the capability of going back into that edit record. So if you wanted to change anything on your patient account, you could do that. To print out the patient summary sheet, to copy this patient record. For instance, if you've discharged this patient, you want to readmit them under a new account, you can actually copy this record to a brand new account. And then throughout the system, we have an information section that gives you your change log, your audit log for anything that's happened to this particular patient account. And you can also just click on the little icon here if you wanted to add in a picture of your patient. So pretty simple things there. So this is the manual data entry way. Let's say we received a fax on a fax machine, how we would allocate and enter our patient information.